Hello, everyone. Welcome to Pod Bites, where we break down complex medical topics into bite-sized pieces, perfect for your commute, coffee break, or whenever curiosity calls. I'm Sara Alnachef, your host for today's episode, and I'm joined by Hajar Saeed to discuss one of my favorite psychiatry topics, personality disorders.
Hi, Sara. I'm excited to dive into this topic today. Personality disorders can be quite complex, but we'll try to make them easy to understand.
Perfect. So let's start from the basics. Hajar, what exactly causes personality disorders?
Great question, Sara. Personality disorders often originate from a combination of genetic and environmental factors, especially experiences during childhood. Chronic mistreatment or neglect can actually alter brain structure.
Oh, really? How so?
For instance, these patients tend to have fewer GABA receptors, which makes it harder for them to feel calm and relaxed. Another area affected is the hippocampus, which helps regulate emotions and memories. Additionally, trauma can impact the corpus callosum, which connects the two hemispheres of the brain, leading to difficulties in processing emotions and stress.
Wow, that really highlights how early life experiences shape us as we grow older. With that in mind, let's move on to the different types of personality disorders. I know they're categorized into clusters. Can you tell us more about that?
Of course. Personality disorders are grouped into 3 clusters based on shared characteristics. There's cluster A, B, and C. Cluster A is described as odd and eccentric, including paranoid, schizoid, and schizotypal personality disorders. Cluster B is often seen as dramatic and emotional, including antisocial, borderline, histrionic, and narcissistic personality disorders. Cluster C is more about anxiety and fearfulness, including avoidant, dependent, and obsessive-compulsive personality disorders.
Got it. It sounds like Cluster B has a lot to unpack, but let's go in order and start with Cluster A, with a case as we always do.
Sure thing. Okay, let's set the scene. You're a therapist meeting a new client, Adam, a 40-year-old lawyer. He starts the session by insisting the room isn't private enough and accusing your receptionist of spying on him. He recounts how his colleagues are plotting against him at work and how even his wife might be keeping secrets.
Oh, he sounds like he's really paranoid. So what's going on with Adam?
Well, exactly that. Adam's behavior points to paranoid personality disorder. This condition is marked by a pervasive distrust and suspicion of others without sufficient basis. Unlike schizophrenia, these patients are fully functional. They can hold jobs, have families, but they're constantly reading hidden meanings into things.
Ah, so they're not hallucinating like in schizophrenia, just hyper-suspicious?
Exactly. They suspect without evidence, which makes it really tough to build or maintain relationships. They're also described as unforgiving and hypersensitive to criticism.
So who's most at risk for this kind of behavior and what causes it?
Well, paranoid personality disorder is more common in males, and it may be linked to genetic factors, especially if there's a family history of schizophrenia. Environmentally, early experiences of betrayal or childhood trauma can also play a big role.
Okay, I feel like these are actually pretty easy to point out. Just really quickly, what should we look out for if we're trying to diagnose this?
Key clues include unwarranted suspicion of others' motives, reluctance to confide in people, and interpreting benign comments as threats. They're also resistant to therapy because they often suspect that even the therapist has an agenda.
Right, so any kind of behavior that shows irrational mistrust will have paranoid personality disorder at the top of our differentials.
Yeah, well, sure. Let's just move on to the next one.
All right, what have we got?
So here's our next case. Imagine Clara, a 35-year-old librarian who avoids eye contact, rarely speaks unless spoken to, and spends her weekends alone with books. She's indifferent to praise or criticism, and she has no interest in friendships or romance.
Sounds pretty isolating. So what's going on with Clara?
Clara might have schizoid personality disorder, which is characterized by detachment from social relationships and a limited range of emotional expression. They're not anxious about rejection, they just don't see the point of relationships. They're often seen as loners for that reason.
So they're not lonely, they just prefer being alone?
Exactly. They're content with solitude, and they have little desire for close relationships.
This kind of sounds like high-functioning autism. Someone who can work and go to school but is isolated and prefers to be alone?
Yeah, you can think of it that way.
All right, I think that about covers it. Shall we move on to the next case?
Let's do it. Here we have Omar, a guy who believes he can predict the future based on star patterns. He dresses eccentrically, he has few friends, and he often talks about magical powers. His ideas are odd, but not delusional.
He sounds like a whimsical dude. But this is kind of like a mix between schizoid and schizophrenia.
Yeah, exactly. It's schizotypal personality disorder, which is marked by social deficits, cognitive distortions, and eccentric behavior. They might believe in telepathy or have odd speech patterns.
Okay, so it includes both psychotic symptoms as well as difficulties in interpersonal relationships.
Yeah, and they're not fully delusional like in schizophrenia. Their beliefs are unusual, but they're not completely disconnected from reality.
Got it. And who's most at risk of developing this disorder?
So it's slightly more common in males, and it may have a genetic link to schizophrenia. Many times it presents during childhood or adolescence, but unfortunately, it gets overlooked in the differentials. When it presents in childhood, it's called schizotypal disorder of childhood, or SDC. This can present with an overlap with schizophrenia and autism.
All right, yeah, that makes sense. I think we're done with cluster A now, right?
We are indeed. Care for a quick recap, or are you all set?
I mean, I don't need a recap, but the audience probably does. And we should recap for them, not me at all.
Sure, if you say so. Okay, so we started off by discussing paranoid personality disorder. We said that the main features here are that patients present as distrustful and suspicious. For schizoid, it will likely be someone showing signs of detachment and limited emotions. And finally, schizotypal is what we described as someone having odd beliefs and social deficits.
Yep. I knew that. I hope you guys are listening and all took note of that. Okay, Hajar, why don't we quiz them with some practice questions to really make sure it's stuck?
Excellent. I'll get us started. All right. A 40-year-old man lives alone, avoids social events, and shows no emotional response to compliments or criticism. Which personality disorder does this suggest?
The answer is schizoid personality disorder.
Awesome. Next, a 45-year-old man refuses to answer his doctor's questions, believing the information might be used against him. Which personality disorder does this suggest?
The answer is paranoid personality disorder.
And finally, a 35-year-old man believes he has special powers and avoids social interactions due to his odd beliefs. Which personality disorder does this suggest?
And the answer is schizotypal personality disorder. Great job, everyone. Let's move on to cluster B now, the dramatic and emotional.
This is where things get really interesting. Cluster B includes borderline, histrionic, narcissistic, and antisocial personality disorders. Definitely a lot to cover and very, very high yield for exam purposes. Some of you might already be familiar with some of these.
Okay, my thinking cap is on extra tight now. Let's get into it. What's our first case?
All right, imagine Buffy, a 28-year-old woman who becomes intensely attached to her therapist. She moves across cities to be near him and experiences severe mood swings. From idolizing him one day to accusing him of betrayal the next, she's attempted suicide multiple times following perceived rejections.
Geez, that sounds really intense and heartbreaking. A classic presentation of borderline personality disorder, right?
Exactly. Borderline personality disorder is characterized by unstable moods, self-image, and relationships, along with impulsivity and a fear of abandonment. Self-harm and suicidal behaviors are also common, and keywords that you should watch out for.
Sounds like it's a roller coaster of emotions and relationships.
Sadly, yeah. Their emotions can shift rapidly and intensely, often triggered by fears of being abandoned.
Okay, and who's most at risk and what causes it?
It's definitely more common in women, especially those with a history of childhood trauma like abuse or neglect. Genetics may also play a role, particularly if there's a family history of mood disorders.
Okay, and what's actually happening in their brains?
Well, borderline patients often have an underactive orbitofrontal cortex, which impairs emotional regulation, and an overactive amygdala, which heightens emotional responses. Reduced GABA receptors can also make it harder to calm down after emotional outbursts.
That makes sense. And how do we go about diagnosing borderline personality disorder?
Key signs include a fear of abandonment, unstable relationships, identity disturbances, impulsivity, self-harm, and intense mood swings. Feeling empty and using defense mechanisms like splitting and projection are also common.
That must be really tough to deal with for them and those around them. How can we help them?
Dialectical behavior therapy, or DBT, is the gold standard. It focuses on emotional regulation and building interpersonal skills. Medications like mood stabilizers and antidepressants can help manage symptoms, but they're not a cure.
Okay, so from what it sounds like, DBT and antidepressants. Got it. What's our next case?
Okay, moving on. Here we have a 30-year-old actress who enters a party like it's the Oscars. She's dressed to the nines, speaks dramatically, and switches emotions faster than TV channels. If she's not the center of attention, she becomes visibly uncomfortable.
Sounds like she lives for the spotlight. So what's going on with her?
Well, her behavior suggests histrionic personality disorder. This condition is marked by excessive emotionality and attention-seeking behavior. They often display shallow emotions and are uncomfortable when not the focus of attention.
So they're kind of like drama magnets?
Exactly. Their emotions are intense, but often lack depth.
So how do we spot histrionic personality disorder?
It's important to look for behaviors like dressing provocatively, shifting emotions quickly, and exaggerating relationships' intimacy. They're also highly suggestible and thrive on praise.
All right, I'll definitely look out for those. What's our next case?
Next up, imagine Alex. He's a CEO who talks about his success at every opportunity. He dismisses his team's opinions, he feels entitled to special treatment, and he's enraged by even mild criticism. His wife also complained that he's cheated on her multiple times in the past.
Jeez Louise. So what's Alex's deal?
Alex likely has narcissistic personality disorder, characterized by grandiosity, a need for admiration, and a lack of empathy. He believes he's unique and deserving of special treatment.
Sounds like he's all about me, me, me.
Pretty much. His self-esteem is actually fragile underneath all that confidence.
So how do we diagnose this? I assume he'd be too proud to go to a therapist and admit to his behavior.
Yeah, actually. Patients with narcissistic personality disorder usually go to the clinic for other reasons, like depression or anxiety. You can definitely pick up on the clues, though, when they do come in. Look for grandiosity, a sense of entitlement, exploitation of others, and hypersensitivity to criticism. They might even try to belittle their doctor and insist they know better.
Okay, I see.
All right, let's talk about Chris, a 35-year-old with a long rap sheet. He's been in and out of prison for theft and assault. He shows no remorse and is incredibly charming when it suits him.
That sounds dangerous. What's Chris's diagnosis?
Chris likely has antisocial personality disorder, which is characterized by a disregard for others' rights, impulsivity, deceitfulness, and a lack of remorse. It's often associated with a history of conduct disorder before the age of 15.
Whoa. It literally sounds like you're describing a psychopath or a sociopath.
Psychopaths and sociopaths do fall under this category.
Oh, okay. Now that you said that, it makes a lot of sense. I feel like I can already connect all the pieces together. Okay, but who's most at risk and why?
It's more common in men, especially those with a family history of the disorder. Childhood abuse, neglect, or exposure to violence significantly increases this risk. It's usually caused by both biological and environmental factors. Biological factors include reduced arousal in the autonomic nervous system and reduced activity in the orbital cortex of the frontal lobe, which leads to impulsivity.
And the environmental factors?
These include family instability, poverty, and conditioning and abuse.
That is tough. Okay, there's just one more thing that's confusing me. I might be totally tripping here, but this sounds an awful lot like narcissistic personality disorder to me. How do we tell them apart?
I was waiting for that question. Good. It means you've been focusing. They are very similar in terms of characteristics, especially in that they lack empathy. But you really want to distinguish them by the fact that antisocial personality disorder is highly associated with a history of misconduct and getting in trouble with the law. You don't really see that as much or as significantly in narcissistic personality disorder. Remember, think about how psychopaths usually have antisocial personality disorder.
Okay, that clears it up so much. Thanks a lot. But can they have both antisocial and narcissistic personality disorder?
They very much can. And this contributes to the overlapping features that we see.
Right, it's all clear now. So we can spot antisocial personality disorder by a history of violating others' rights, deceitfulness, impulsivity, and lack of remorse.
Exactly. And they're often manipulative and charming to get what they want.
Okay then, I think we've officially aced Cluster B. What's next?
Whoa, not so fast. Let's give our listeners a quick recap before we move on. And since you've been so attentive, why don't you do the honors?
I'd be happy to. All right, listeners, let's recap Cluster B. First off, borderline personality disorder is characterized by emotional instability, a fear of abandonment, and self-harm, and it's treated with DBT. Next up, histrionic personality disorder is the attention-seeking one, often with seductive behavior. Narcissistic personality disorder is characterized by grandiosity and a lack of empathy. Finally, in antisocial personality disorder, we see a disregard for others and the law.
Amazing. Okay, let's keep the pattern going and test our listeners with some practice questions. A 40-year-old man demands special treatment at work and is enraged by criticism. Which personality disorder does this suggest?
The answer is narcissistic personality disorder.
All right, moving on. A 28-year-old woman frequently dresses provocatively, craves attention, and describes acquaintances as close friends. Which personality disorder does this suggest?
The answer is histrionic personality disorder.
Next, a 30-year-old man frequently breaks the law, shows no remorse, and lies effortlessly. Which personality disorder does this suggest?
And the answer is antisocial personality disorder.
Finally, a 25-year-old woman presents with repeated suicide attempts, intense fear of abandonment, and rapidly shifting emotions. What does this suggest?
The answer is borderline personality disorder.
Great job. Let's quickly go over cluster C now. This should be a short one.
Yeah, also known as the anxious and fearful. Take it away, Hajar.
Absolutely. Cluster C includes dependent, avoidant, and obsessive-compulsive personality disorders. We'll touch on some of them briefly.
All right, what's our first case?
Okay, so Layla is a 30-year-old who struggles to make even simple decisions without calling her partner for advice. She avoids disagreements at all costs and stays in unhealthy relationships out of fear of being alone.
That sounds exhausting. So what's going on with Layla?
Layla likely has dependent personality disorder, characterized by an excessive need to be taken care of, leading to submissive and clinging behavior. They often have difficulty making decisions independently.
So from what I hear, they basically need a lot of reassurances, even for small decisions.
Exactly. They fear abandonment and often go to extreme lengths to gain approval and support.
That's really sad. They will just go to any lengths not to be alone. Okay, what's our last case?
Finally, we have a 40-year-old accountant who spends hours organizing his files to perfection. He refuses to delegate tasks and becomes frustrated when things aren't done his way, and struggles to maintain friendships because he prioritizes work over relationships. He insists on rigid routines and often criticizes others for being inefficient.
This also sounds exhausting. So what's going on with him?
He likely has obsessive-compulsive personality disorder, or OCPD, which is different from obsessive-compulsive disorder, or OCD. OCPD is characterized by a preoccupation with order, perfectionism, and control, often at the expense of flexibility and efficiency. Unlike OCD, these patients don't experience intrusive thoughts or compulsions. They just have an extreme need for order and control.
So unlike OCD, where patients are distressed by their compulsions, OCPD, patients see their behavior as completely normal?
Exactly. OCPD is egosyntonic, meaning patients believe their way of doing things is correct and struggle to see the issue.
Got it. Okay, let's recap cluster C now and call it wraps.
Let's do it. So we discussed dependent and obsessive-compulsive personality disorder. Dependent is characterized by being submissive and clingy due to fear of separation. And obsessive-compulsive personality disorder, or OCPD, is preoccupied with order, control, and perfectionism, often at the cost of efficiency and relationships.
Yeah, and just remember, cluster C is all about anxiety, but in different forms. Here are some final questions about cluster C to make sure you've aced personality disorders completely.
Let's begin. A 35-year-old woman avoids making decisions without her partner's input and fears abandonment. Which personality disorder does this suggest?
And the answer is dependent personality disorder.
Next, a 45-year-old man is extremely focused on order, rules, and perfectionism. He struggles to delegate tasks and believes his way is the only correct way. He does not experience intrusive thoughts or compulsions. Which personality disorder does this suggest?
The answer is obsessive-compulsive personality disorder, or OCPD.
Right on. I think we did a pretty good job at breaking down these personality disorders, Sara. Don't you?
Oh, absolutely. Me personally, never forgetting them. In fact, I kind of want to show off for a sec. I want to make sure everyone remembers all the classifications.
Sure.
So, in summary, cluster A is the odd and eccentric and includes paranoid, schizoid, and schizotypal personality disorders. Cluster B is the dramatic and unpredictable, which includes borderline, histrionic, narcissistic, and antisocial personality disorders. Finally, cluster C is the anxious and fearful, which includes dependent, avoidant, and obsessive-compulsive personality disorders.
You nailed it, Sara. That was radical. Perfect summary. Dab on him.
Thanks, Hajar, and thank you so much for joining me and making this topic so much more approachable.
My pleasure. I hope our listeners found it helpful and maybe even a bit entertaining.
Oh, yeah. And to our listeners, thanks for tuning in to Pod Bites. Make sure to subscribe for more episodes where we simplify complex medical topics just for you. Until next time, stay curious and dab on them.